So good morning everyone. In this video we are going to see about the axis and planes through which the movement happens in the human body. Okay. So first we should know about what is the anatomical position of the human body. The anatomical neutral position is standing upright, legs together and knees straight. The legs are apart a little bit and toes pointing forward, arms by the sides and palm facing forward. That's your anterior. Okay. So here we do have three views of the human body: the posterior view, the lateral view and the anterior view. As you can see, this is all taken in anatomical position, neutral anatomical position. So the human body performs a motion through a plane and around an axis. So what is a plane? So plane is an imaginary flat surface along which the movement is taking place. So what is an axis? Axis is an imaginary line about which the body rotates along the plane. Okay. So there are three planes: sagittal plane, coronal plane and horizontal plane. Whereas there are also three axes, that is sagittal axis, coronal axis and transverse axis. So here we are able to see the sagittal plane. Okay. So it divides the body into vertical plane. So it is a vertical plane of the body which passes from the front to the rear. Okay. Divided into two symmetrical halves. That is going to be your left and right symmetrical halves, equal symmetrical halves. Okay. Sagittal plane is an anatomical plane which divides the body into right and left parts. Yes. So the movements in the sagittal plane are normal biceps curl, squats, walking, running, vertical jumping, climbing stairs, dorsiflexion of ankle and plantar flexion of ankle, and flexion and extension, okay, of the elbow joint. So next we are moving to the horizontal plane. The horizontal plane of the body is all lying parallel to our diaphragm, okay, the respiratory muscle. It is called as transverse plane or else the horizontal plane. This transverse plane, also known as the horizontal plane or transaxial plane, is an imaginary plane which divides the body into superior and inferior parts, that is up and down, okay, upper part of the body and the lower part of the body. Then it is perpendicular to the coronal and sagittal planes. So as you can see in this picture, the horizontal plane divides the body into upper and the lower half. Okay. So it is parallel to the diaphragm. So some movements taking place in the horizontal plane are pronation and supination of forearm, the retraction and protraction of your scapula, then horizontal abduction and horizontal adduction of the shoulder, and all kind of rotations, hip rotation and shoulder rotations takes place in this plane. So next we are moving to the frontal plane, the plane of the body which passes from the side to side, from left to right direction at the right angles of the sagittal plane. It's called as frontal plane. It's perpendicular, so it is opposite to the sagittal plane, okay, or the coronal plane. Frontal plane is also known as the coronal plane. The coronal plane is any vertical plane that divides the body into ventral and dorsal sections, that is your anterior and posterior sections, or just call them as belly and back sections. So as you can see in this picture, so it passes from the left to right, it divides the body into anterior and the posterior parts and the belly and the back part. The movements taking place in the frontal plane are abduction, adduction, the radial deviation and the ulnar deviation of the wrist, side flexion of the trunk and the side flexion of the neck, then inversion and eversion movements of the ankle. Okay. So there is an exception here where the circumduction of the shoulder joint is not included in the movement or either in a plane nor an axis. So it is also called as no axis, no plane movement. So here we can summarize these three planes: transverse plane dividing the body into upper and the lower parts, frontal plane divides the body into anterior and posterior sections, then the sagittal plane divides the body into left and right. So we are moving to the axis of moments here. So before moving to the axis of moments, we should know what is the Cartesian coordinate system. So that determines the axis of moments. So Cartesian coordinate system is normally a graph that consists of x-axis, y-axis and a z-axis. Okay. The Cartesian coordinate system is a coordinate system that specifies each point uniquely to its plane. So x-axis is unique to its, y-axis has a unique plane, then z-axis also having a unique plane. Okay. So we are moving to the sagittal axis. It is also called as the antero-posterior axis, which bisects the body laterally from side to side, dividing into front and back halves. The plane regarding the sagittal axis is the coronal or the frontal or lateral plane, which is normally perpendicular to this axis. The frontal plane divides the body into front and back. So here in this picture, this is the sagittal axis, so which is perpendicular to this frontal plane. Moving to the vertical axis here, which divides the body horizontally into superior and inferior halves. Regarding the plane that is the perpendicular planes are horizontal or transverse plane. This plane divides the body into top and bottom. So the vertical axis, if you draw a line from here to here, like a straight line, so it will be perpendicular to this transverse plane. Okay. So we are going to see about the coronal axis next. So it is also called as the frontal or lateral axis. It bisects the body from the front to back, dividing into left and right halves. The sagittal plane passes through the body front to back, so dividing it into left and right side of the body. So the axis is this line. So it lies perpendicular to this plane, which divides the body into left and right. The summary of this is the plane is the place or a surface upon which the movement take place or along the movement take place. Okay. Then axis is a straight line in which an object rotates or the body part rotates. Okay. The movement of the joint takes place along the plane about an axis. Okay. Axis and planes are perpendicular to each other. The plane regarding coronal axis will be sagittal plane. The plane regarding horizontal or transverse plane is vertical axis. Then the plane regarding the sagittal axis is coronal, frontal or lateral. Thank you.